everyone, I'm Alexandria. Thanks for joining us today. We are going to talk about how to treat a swollen knee. Swollen knees can happen for various reasons. Our knee is a very complex, mobile joint that is designed to take lots of pressure, weight, and exertion. However, if you have a swollen knee, there can be very serious underlying causes, or it can be something from very simple wear and tear or just a tired knee. A swollen knee occurs when excess fluid accumulates in, on, or around your knee joint. Your doctor might refer to this condition as an effusion in your knee joint. Some people call this condition water on the knee. A swollen knee may be the result of trauma, overuse injuries, or an underlying disease or condition. To determine the cause of the swelling, your doctor might need to obtain a sample of the fluid to test for infection, disease, or injury. Now we're going to talk about some of the symptoms related to the swollen knee. Obviously, you're going to see visually that it is swollen, but it also is going to come with several physical pains as well. Swelling, as I mentioned earlier, is the skin around your kneecap can puff up noticeably, especially when you compare the affected knee to the normal one. Stiffness. When your knee joint contains excess fluid, you might not be able to bend or straighten your leg completely when that fluid builds up. And finally, pain. Depending on the cause of the fluid buildup, the knee might be very painful, to the point that it's difficult or even impossible to bear weight on. If you suspect that there might be a really serious underlying problem, definitely consult your doctor, consult your medical care professional that you trust so that they can really help diagnose what can be an underlying cause of your swollen knee and really help treat that accordingly. Treatments really may vary because of the severities can really vary, so your doctor may try one treatment approach or a combination of several. Medications are a great way to really help reduce swollen knees, especially if there is an infection involved. Your doctor may prescribe you antibiotics to cut down on the infection, swelling, and ultimately the relief. Treating the underlying cause of a swollen knee that might be serious may require something like surgical or other procedures may be an action that your doctor might want to take if there's something very serious underlying. Arthrocentesis is removing fluid from the kneecap can help relieve pressure on the joint. After aspirating that joint fluid, your doctor might inject a corticosteroid into the joint to treat inflammation. Arthroscopy, a lighted tube called an arthroscope, is inserted through a small incision into your knee joint, and then tools attached to the arthroscope can remove loose tissue or repair damage in your knee. And finally, joint replacement. This is going to be if a very serious injury has happened. If bearing weight on your knee joint becomes intolerable, you definitely might need knee replacement surgery. Sometimes swollen knee is just caused by normal wear and tear or just your knees being tired of overuse of that day. So if this may be the case, you can definitely look into some home remedies to really cut down on that swelling. These are going to be things like the RICE treatment, which stands for rest, ice, compression, and elevation. If you follow those steps, chances are you're going to greatly reduce the swelling in your knee. Also, you can maybe try a TENS unit therapy device. This is going to be another non-invasive way you can treat the pain right at home. TENS unit uses electrotherapy to really help disrupt the pain cycle in our brain and help rewire our brains of how we perceive that pain. It also really creates lots of endorphins in our body, which is our body's natural painkiller and also gives you an overall feeling of well-being. Thank you guys so much for joining us today on how to treat your swollen knee. We've given you great tips and tricks, but again, if you suspect there's a serious underlying problem, definitely consult your doctor. Don't forget to hit the like button, comment below, and subscribe so we can keep you up to date on all of this great information, and we will see you next time.